Does scheduled sex ruin intimacy when trying to conceive? Imagine planning a special moment with your partner and feeling like it's just another task on a list. That's what some couples worry about when they start scheduling sex to increase their chances of conception. But does it really ruin intimacy? Not necessarily. Let's explore what the facts say. Timing sex around ovulation can boost the odds of pregnancy because it places sperm closer to the egg when it's released. Using ovulation prediction kits or tracking basal body temperature helps identify the best days. Having sex every 2 to 3 days throughout the cycle is also effective and less stressful than strict timing. Daily sex isn't always better and can sometimes lower sperm count in men, so finding a rhythm that feels natural is best. Some couples find that scheduling sex makes it feel more like a chore, which can lead to stress or pressure. This can make intimacy less spontaneous and more mechanical. When sex feels like a task, it might reduce emotional closeness and cause anxiety. That's why it's important to keep the emotional connection alive beyond just timed intercourse. Open communication is key. Talking about feelings and expectations helps reduce stress. Couples can also focus on non-sexual touch, cuddling, or shared activities to stay close. Sometimes, having sex outside the fertile window or scheduling intimate moments that aren't solely about conception can keep things playful and relaxed. This approach helps maintain a sense of closeness and fun. It's also helpful to remember that having sex every 2 to 3 days during the cycle is usually enough to increase chances of conception without making it feel like a chore. If stress or emotional distance grows, seeking support from a counselor or joining a support group can be beneficial. Gentle pelvic positioning after sex can support conception without making sex feel clinical or forced. In the end, scheduled sex can be a useful tool for boosting fertility, but it doesn't have to take away from intimacy. Balancing biological timing with emotional connection is the best way to keep your relationship strong while trying to conceive. Making sure both partners feel relaxed and connected can turn this journey into a shared experience rather than a stressful task.